to the Eat, Slay, Live podcast.
And we are the Loxecutioners. We're going to be eating lightning and talking thunder and power bombing you right in the ear holes today.
Welcome to the Eat, Slay, Live Daily Grow with myself, Todd Locks, the People's Champ. Sorry there was no show yesterday. We got a big project going on down here at the Thunderdome, and that was taking up some of my time. It is National Mental Health Month of May and we've been talking about little different segments on here. Talking about things that I do to kind of make my life a little better, a little happier, talking to people who've had some struggles themselves. Still getting a lot of traction on my sister Sammy's her story when she was on here. If you haven't seen that, check it out. It really is amazing. It's the only one I've actually went back and listened to myself. Because you won't believe this, but I hate hearing the sound of my own voice. And we also are having professionals on, which we have today. On the show today, I have Megan Tyler. She is the founder and director of Sacred Spaces of Care in Alton, and also Andrea Reed, who is a school psychologist over in Missouri, and she's also is a chairperson of the board. And they're going to talk a little bit about what they do, how they're founded, and what their mission is. So I'm going to bring them on board right now. There is Megan and there's Andrea. Welcome to the show, guys.
Hey, good morning.
Good morning.
Couple things. We talked this off air, but look at Andrea with the product placement, the pride. She got a little picture there. Her daughter won the Workhorse Award. Look at that. Very well. Very good. So you guys are with the Sacred Cares of Sacred Space of Care. And now, can you tell me a little bit how it came about? Megan, I'll start with you. I know you founded it.
Mm-hmm. Yeah, so I have been in education. Obviously, that's where Andrea and I met for several years, mostly working in like high trauma, high need settings. Always been a big mental health advocate. And then I have some of my own lived experience, as well as people that are close to me that I love that have struggled with different mental health battles, substance use, addictions, those types of things. So it's been like a several year, long time coming like vision that I had where I knew I wanted to move into this space. And we were kind of looking at what were some of the gaps in the community, because we have some resources. We didn't really want to duplicate those things. But we wanted to figure out what the gaps were and see how we could fill them. And mainly that is just that when you're in those crisis moments, it's just so difficult. You feel isolated, you feel alone, trying to navigate the systems. Where do I start? How do I take that first step? And so Sacred was kind of launched and founded to walk alongside individuals when they're in that process and just kind of be that safe space, a sacred space for them during that time to kind of walk alongside in that journey. So that's where it began, reached out, kind of started to form the board of directors, and then it has definitely, evolved and kind of grown and ebbed and flowed in different ways since getting started. So
now where did you and Megan meet?
So in the elementary school that where I currently work at, and Megan was a colleague of mine. And again, like she mentioned, a high trauma setting, really living that day to day with the children who are experiencing trauma. And, what Aaron Bickle mentioned last week, that complex trauma, the trauma that children just cannot escape from. And really we experience just the long-term effects of what that can have on a child and potentially their outcome, later in life.
Is that how you were in the school district, you saw a need? Is that how it kind of ultimately came about?
Well, with the children, but then Megan saw a community need. She saw like the larger need.
Yeah, I think for me, I had founded another very small scale nonprofit in the past that was related to like educational options in the community for people. So for me, personally, I was struggling with, I loved my career in education, but by the day I kept getting further and further away from academics and more into the social emotional side. And I wanted to be in a space where I had more freedom and more liberty to kind of tackle those types of deeply rooted, trauma needs. And I kind of joke and always say, like, I used to tell people, I'm just here to love kids. And if I happen to teach them something, great. So the academics just kind of, it wasn't that it's not important. I'm not trying to diminish that side of it, but it wasn't where my heart was anymore. And then I just had people in my own life that I was walking alongside that just kind of brought to light, like, man, this is tough. Like, people need somebody to kind of walk through this with them. And that's kind of what led me to launch and go that direction and change spaces. So
you guys have recently, you're just a little over a year, right? You had your 1 year anniversary not too long ago. Is that correct?
That's correct. Yes.
Congratulations on it. Now, it's not easy to start a nonprofit, is it? People don't realize the struggles and things you have to go through, correct?
It is not. And just I didn't know I had this vision, but, getting a board of directors, like I tell Andrea and my founding board this all the time, like, I'm always going to be grateful to those individuals, because when you propose a mission and a vision to someone and they are so willing to come on board, like not knowing what that even looks like in practicality, I appreciate the trust that they had in me to get it going. And then, yes, I mean, it is eat, sleep, breathe, the development of it for a very, very long time. And most people don't know, like, we're still in our infancy, like it takes years to really get to where you're at a solid footing and sustainability. You're consistently seeking after new funding sources and trying to, make sure that you are staying very true to your mission and mindful and intentional and all of those fun things. So yes, just the business building side of it, compacted by trying to make an impact at the same time and having fruit of our labor it's a lot in the first year for sure.
Now, you're talking about filling gaps. Now, could you explain a little bit about, I know you guys, you work very closely with the Alton Police Department, I've seen.
Yeah.
So is that something like, say an officer runs into someone who's experienced trauma, or or a person who's had some trauma and maybe they're don't know where to turn? Is that where you guys come in?
Yeah, so we do a combination. So we operate a co-response model. So I am at the PD pretty much full time, and I vary my hours between days, evenings, and weekend stuff. So I can co-respond on scene with officers when individuals are in crisis related to mental health, substance use, and can try to help to just de-escalate and be kind of a neutral person in that environment where I don't have maybe the intimidation or the consequential kind of things that the officer does, and just help that person to process what's going on in the moment. So we do that a lot. And then we can also connect those individuals to resources after the fact. So that was one of the things. There's probably over half of the APD is trained in what they call crisis intervention teams. And so a lot of the officers are fairly decent at like trying to navigate, de-escalate in those moments. Obviously, like safety is the concern in those moments, but then it's how do we really help those people to start a journey towards healing? How do we make sure they get connected to community resources that are available to them? So we can co-respond in the moment, and then we can also provide that follow-up to make those linkages to what's available to them, whether that's, substance use treatment, mental health care, even medical physician related stuff, essential needs. Do they need food, shelter? What does that look like for that individual? And how do we kind of help get them connected?
Now, will they call you onto a scene, or will they give you, give the people there your number? How does that operate?
It's a little bit of everything. So I do co-respond. So I can go out with the officers. I'll either be at the PD and we'll get a call of that nature, and I will go with the officers.
And what might a call like that be? What might be an example of a call?
So we get a lot of calls that are maybe there's a suspicious person, or there is someone calls in wanting like a welfare check on someone. So what the general public doesn't probably know is that many of these calls, there's not a crime being committed at all, but the PD is still expected to respond because there's some kind of welfare or safety of an individual or others, that's going on in that moment. And so we might get a call that, someone passed by and saw someone walking down the road and it seemed like they were kind of in a state of crisis, or maybe they were, trespassing on a property, or there's a business owner that would like them to be removed from the property. They're causing a scene, or, whatever that might look like. And usually it's related to the mental state that they're in at that moment, or maybe the influence of substances that they're on in that moment. And so that's when I can go alongside the officer. We have a new grant that Chief Ward and I worked on that just started in March as well. And so it's a proactive, like, community policing approach. So we now have an officer 5 days a week for about 4 to 6 hours a day that does not respond to general patrol calls. They are strictly responding to those crisis situations. And when we're not on an active call, then we can go out and proactively engage, like, our unhoused population and others, and try to link them to services. And we have a transport vehicle now where we can actually transport people to treatment facilities or whatever they might need in the moment. So there's various ways that it happens, whether it's patrol and in the moment, on scene response. They can call me to a scene. Officers can refer individuals to me after the fact if I'm not present. So there's multiple avenues of how that person can get help.
I think probably, like, back in the day before you came on the scene, I think they took those individuals and they picked them up and they just drove them and dropped them off in Granite City before.
Yeah, I mean, it kind of depends. Well, Alton doesn't have psychiatric services at all, which is a huge disadvantage for our community. So our local hospital systems have no psychiatric services. And so Gateway would be, in Granite, would be the closest medical facility. We have, like, Granite City or Touche would be the next, or if you're going to go over to Missouri, like, DePaul has behavioral health. But yeah, that happens a lot, because if anyone is actively suicidal or homicidal, that is the only facility that they are going to go to at that point in time, because it's the only facility that can accommodate the suicidal or homicidal ideation at that point in time. So, yeah. And
I was just I wasn't even referring to
okay.
Drop them off somewhere.
Well, I was just clarifying.
Yeah, it's a little joke. Andrea, now, as being a chairperson of the board, and I looked up, and you guys have a great assortment of different people that sit on the board. It seems like different backgrounds. So what, as a chairperson of the board, kind of what is your duties?
Well, first, just as a board chair, just a lot of strategic planning, governance, and that's something that I've been learning along the way. But my background as a school psychologist, my niche that I would say is, the childhood trauma, so Megan's talking about, adults having those struggles with mental illness, substance abuse, etc. So, where I come in, I love sharing information about the effects of childhood trauma. So one part of our organization is we have partnered with the Hanner Library in Alton. And I would say every few months, we try to do it monthly. We do a trauma training. So the next one we have is May 29th.
Who are you training?
Public. Anybody that wants to come and learn about the effects of trauma, not just childhood trauma, but even trauma that's experienced later in life, and, the potential effects that you need to be mindful, like listen for, watch for. I know Megan's also done trainings for specific organizations that, want that, whether it be educators or, police officers and things like that. So there's a lot of information that I could definitely go into.
Yeah. Are we just seeing like or are we just now aware of it? Is it just a growing mental health issue in this country, in this world today? Were we just not aware of it back in the day? It was, suck it up, gonna be okay, whatever, be tough or whatever. Or is it we just seeing these giant problems now? Is it growing, or are we just more aware?
I think we're more aware.
Yeah,
of what to look for.
Yeah, and then I think there's just contributing factors, that are just a variety. We're more aware. It's more visible. Our resources, we're under-resourced, so it's more visible in the community. I think that there was, there's been changes over the course of a few decades in like what our institutions are able to provide. There were a lot of shifts in the type of care, really. And then, I think combating the fact that our mental health options decreased, and then our substance use kind of pandemic or epidemic increased, I think that has really compacted the issue. And so, I don't think it's that it was never there. I just think it's grown and it's more visible, and we have a lot more people that are kind of in those substance use spaces that are experimenting with a lot more things now, and our drugs are just a lot more, gripping, I think, than not that they never were, but it's just a different dynamic.
Yeah. And a lot more research, I think. There was a big study done in the late 90s looking at, adult outcomes and comparing it to the experiences of their childhood. And one thing that stood out to me is like at least 5 of the 10 leading causes of death can be contributed to adverse childhood experiences. So we're looking at suicide, cancer, heart disease, diabetes, respiratory diseases. And so, that's pretty staggering, and I know you had Laura on earlier in the month, and we're, talking about just overall health and, just how everything can be so linked together, with trauma, mental health, or mental illness, substance abuse. So that was a pretty staggering statistic.
Yeah. And I think so many more contributing factors these days. Like we talked about with Laura, like the food we eat, it's not real food. I think that affects mental health a lot. I think the social media, just people have less communication. There's more like comparing yourself to others, and the feeling of I'm not worthy. I just think there's so many, and drug use. It's just so easy to get now. You know what I'm saying? Anything you want, it's easily accessible. I think so many of these factors are just contributing it today, and it just seems like it's just such an epidemic. And I had my sister on, and she came from a very a really good family, but had suicidal. So it's like I think there's just so many contributing factors in our world today. I think that's why it's become this just giant, use the word epidemic.
Yeah, it truly is. And really trying to figure out the why behind it. Why are we choosing to engage in these behaviors to cope? So, the earlier we can intervene, because, really, we've got to start listening to our kids, they just really paying attention to the comments that they make and not be dismissive, really watching their behaviors. Because, the outcomes, it can be very, very negative if we do not listen to them.
And I think, Tad, when you said, talking about your sister, I think that's what we're working to shift that mindset that, a couple different things that, mental health is health. There is not this differentiation between physical health and mental health. There's such a correlation there, trying to reduce the stigma and, eliminate that like us and them, like it's all of us, it doesn't matter, addiction doesn't discriminate. I have worked with some of the most affluent families that have access to resources that are able to provide treatment options for their loved one, and also the opposite. And there really is no difference in that moment. It really can grip anyone. And I think that when we're talking about substance use specifically, we cannot neglect talking about the trauma. And that's what we're really trying to emphasize, because, a lot of people think that recovery is abstinence from a substance, but that is, if you talk to a lot of people, the easier part. It may not seem like it at first, but what's happening is a lot of the spaces that we're going into, we can abstain from those the unhealthy coping mechanisms in the moment. But if we're not healing the root cause, that's why we have so much relapse and we have so much struggle, continued struggle, is because we're not really healing the root. And so that's where the trauma really comes in, and we got to figure out, deeply what's going on in there and what are some strategies and tools that we can equip people with. So
one thing I go back to, what something Andrea said, is talking about like kids and listening to the kids. I feel like today, like parents are so busy, and then there's like the kids are so involved in sports. They spend a lot of time with the parents going back and forth, and everybody's just so busy that there's not a lot of time where you, like back in my time, when you sat down at the dinner table and you just discussed your day, you discussed problems, you discussed things that were going on. And nowadays, people are just having dinner, looking at their phones, but like we're busy and you spend a lot of time with the kids, but I feel like it's not that quality time. It's running the soccer practice, running to to a volleyball match, run them to a basketball game, and things like that. But there's not a lot of conversations and direct face-to-face communication going on. Do you guys, Andrea, do you see that a lot in your profession in psychology at schools?
Absolutely. Everybody is busy, but also, just listening to some of the kids. I mean, a 6-year-old shouldn't be saying, "I wish I were dead," and if they do say that, you really need to pay attention. Like, why are they saying this? And when I listen to some kids, when they speak with me, one of their things is, well, they don't want to upset their parents, or they're afraid that, their mom might cry if they talk about, a family member's death, things like that. So we as adults, we just have to be ready and willing to have just tough conversations for our kids, because we are those models. We have to teach those skills, and just be willing to listen. And if we don't have those skills, we need to know where to go, for support. Because some adults too, they're dealing with their own trauma, right? So that could be a trigger to them. So if that's the case, that's what we're here for as well. Just being that linkage to additional supports that are available for families.
And I think what's tricky, and I don't want to generalize, but so many of us, maybe I think we're all fairly close to the same age here, and then older generations, it was very hush hush, when you had issues going on, it was, keep them private. I know, a lot of us growing up didn't have the safety of feeling like you could really speak out or share those. Our younger generations are really the opposite. They want to talk. And so I think Andrea's point to listening to our kids, we've got to provide those spaces for our kids and our youth, because they are willing to have the hard conversations, and they're waiting for us to give them the permission to do so. And so that's what we're trying to do as well. We do a little bit of work with the Madison County Juvenile Justice Council, and I've started a group in Alton called United Youth Services in Madison County, and we're really trying to wrap around not just our youth, but those who are serving our youth, trying to equip the adults who are working with these kids in these spaces to really provide that space where they do have acceptance and they can feel comfortable in opening them up. But then the flip side of that is, when we give them that space and they do that, we have to be ready to receive it. How are we going to support them? How are we going to equip them and help them navigate, their struggles? And like Andrea said, most of us are dealing with our own traumas and our own struggles, on top of that. So it's definitely complex. It's not easy work, and it's messy. But, Sacred's here to be that boots on the ground and really be in those spaces. And so, for people who are listening too, I would just encourage, anybody that wants to get involved, but also if you're in that space of, I want to help, but I don't know how to do it, that's what we're really trying to be here for. Like, we do have people that are ready to do that work, and that's where the support really comes in. I've talked with so many people that are so compassionate, and they want to get behind supporting people who are struggling, who are battling mental health and addiction, and who are unhoused and things, but they don't feel comfortable themselves or equipped themselves to know how to support those individuals. And so I always say, okay, well, let us do it for you, or come alongside us in it and do it with us. So that would be, what I would encourage, and an invitation to extend to everybody.
What I love is that you grouped Andrea and I at the same age. I like that.
Well,
Andrea, you're about the same age. I like that.
Hey.
Compliment to me, not so much to Andrea.
Right.
So what is you guys' ultimate goal of Sacred Spaces now? Do you guys, I know you're just 1 year in. It probably seems like you're 20 years. Probably sometimes it feels like you're 20 seconds in. Probably sometimes it feels like you're 20 years in, but you've made a giant impact in that short amount of time. What are your goals? What do you want to get in more into schools like you are the police department? What's the ultimate goal of you guys?
Yeah. So, yes, the Alton PD will continue to be a prioritized partnership, just because of everything we have going on there, like internally with officer wellness, but then the crisis response, and Alton specifically, has significant need, but we do assist, surrounding areas as well. Schools are definitely on our radar, especially Andrea and I have talked about that from the beginning. And there are some, I don't want to speak too soon because we can't at the moment, but there's something coming with that, shortly. I'm a certified mental health first aid instructor, so we're also trying to kind of get that more dispersed into the community. And there's a youth.
Can I stop you there real quick? So you said first aid, mental health. Is that what you said? So
Yes.
kind of like first aid for someone physical, but like this is like a first aid. And can I have you talk? That sounds incredibly interesting. Can you talk about that?
So it's the National Council on Wellbeing actually created this curriculum, this program, and I went through the instructor certification training. So mental health first aid is exactly what you just said. It's like, we know how to give CPR when someone's having a medical emergency, right? But when someone's in that state of crisis, what do we do? And it's just a really good training. It's a one-day training that walks people through just different types of mental health challenges and the effects of substance use. And basically it's helping you to look for signs and symptoms. And what I love about it, Andrea mentioned earlier, how important early intervention is. So it's helping us to see what are those early signs and symptoms so that we can hopefully connect that individual and get, resources to them and the support that they need early on. And then what does it look like when those early signs and symptoms start worsening? And when, how do we know how to support in those spaces? And so there's an adult version of that, but then there's also a youth version, which is for people who are working with youth. And there's a teen version that is often taught in the high school setting to like 10th, 11th, and 12th grade and up. And so we do have plans to do that in one of our local school districts, and hopefully that will expand and grow as well. It's a phenomenal resource to have in the community. Everybody should take the course because it's just equipping you with some tools that you can maybe use. You never know. You can be walking down the street and see someone in crisis. It can be your own family, just helping you to recognize those signs and symptoms, know what to do. And it's great for our kids to have that, in their toolbox as well on how to support their friends, because the younger generations are more apt to speak out and advocate for themselves or their friends. And so we want to make sure they're equipped to know how to do that appropriately.
I love that. I'd never heard of that, but it totally makes sense. We have the physical first aid, but I've never even thought about a mental first aid. And so that's amazing. Well, how can people get involved? If someone how can they get involved? You guys are nonprofit. Where does most of your funding come from? Is it fundraisers or grants, or how does that work for you?
So I'll talk about the grant side, and then I'll let Andrea talk about fundraising. So far, it's been almost purely grant funded. We got very, very lucky. I had never written a grant before in my life. And right after we incorporated, I decided to go after it. We were awarded that first grant and then a continuation. And then Chief Ward and I worked on the CIT grant. So very little of our funding has been through private donations at this point in time. And we are going to continue, obviously, we have some continuation grants and we'll continue to pursue that avenue. But that is one of the board's kind of strategic plans over the next year, is to really look a lot more at private funding and doing a lot of fundraising events so that we can kind of diversify our sources and stuff as well. I don't know, Andrea, if you want to talk about that.
Yeah. So earlier this year, we had a trivia night. So we're starting little. But like Megan said, we're really trying to diversify our funding here because we are primarily grant funded, and that really restricts what we're able to do with like our programs and services. So our goal this year is really sustainability, looking for private donors who are willing to support our mission. We do little things too throughout the year. During this month, we had a t-shirt t-shirt store open, and that just closed on Sunday.
I saw there was some cool shirt. I think one said like, "You good, bro?"
Yeah.
Like
Wait a minute, it's bruh. BRUH.
What was it?
It's bruh. The BRUH.
I'm not down with the kids' lingo.
Exactly.
And the other one was, I think it was, I love this. Tomorrow Needs You. Is that
Tomorrow
right?
Needs You. Yeah, that was my favorite.
That's amazing. I actually just saw
I think that was our most popular sell, was the Tomorrow Needs You. It was a good one.
Yeah. That's very good.
So yeah, just we do little. If you want, follow our socials. We have little fundraisers here and there throughout the year as well.
And I always tell people, if you can't give monetarily or anything like that, like share your page, go like your page, share your page, pass your page on. You know what I'm saying? it's really about getting your awareness out there, getting your content out there, and letting people see what you guys do and what you're trying to do.
Yeah, I think this is a great month to do that too. With it being Mental Health Awareness Month, we were very intentional about pushing out a lot of like educative content just on various mental health conditions and some things like that. So if you check out the page this month, you'll see some of that, and then a combination of, you know, the t-shirts and some other things we have going on just to kind of increase that awareness and let everybody know what we're about. And yeah, sharing the page is great because, you know, it's not just about bringing us attention. That we're here for awareness. So, you know, sharing the page is a way to get information. You know, there's a lot of people struggling and a lot of people scrolling their phones, and you have no idea if just one post could literally shift someone's mindset in that moment when they're in a dark place. And so that's often, you know, what we're finding is to be true. So that can be really powerful.
Guys, thank you very much for coming on. I love the work you're doing. I love when people are just passionate about something, especially when that passion is helping others and making the world around them better. And that seems like what you guys are doing, and you're incredibly passionate. I followed you for a while, Megan, and that's all you do. Is everything is about mental health and helping and awareness and advocacy and everything like that. I love it, guys. Thank you very much. If they want to get in touch with you, just look up your page, or is there a phone number or anything like that?
Yeah, I mean, just Facebook, Instagram, sacredspacesofcare.org is our website. My phone number is the one on all of our promotional materials. So you'll get in touch with me if you reach out. And yeah, I mean, I appreciate, you know, you having us on, and I appreciate, you know, you supporting what we're doing. And that passion is just because I've seen it firsthand, and I've literally seen, you know, lives that can be changed. And I'm just a huge believer in elevating the voice of lived experience and just helping people tell their stories that they've walked, and that's going to really help others. And so that's what we're about as well. So anytime we can do that, you know, I appreciate the opportunity coming on and just sharing about what we're doing. So
awesome. Thank you guys very much. Andrea, maybe I'll see you tonight with your prior duty on. I love it. Anyway, thanks a lot, guys. Keep fighting the good fight. I freaking love it. Thank you very much.
Thanks.
That was Megan Tyler and Andrea Reed with Sacred Spaces of Care. Look them up if, you know, to get involved, see what they're doing, make awareness, share their page. Going to give some birthday shout outs today. Jen Brayfield, happy birthday. Haven't seen your boy at Pride in a while. Jamie Marinick, you and Dan better be sweating for the wedding. Randy Bohannon, you're probably on your paper route right now. Nick Russo, what's up, Nick? Catherine May, I can't say your name, Catherine, sorry. Makopet, Kirsten Macero, Jessica Barackson, Kristen Cruz, Paul Bork, Sean David. What's up, Sean? When are we going to start making Creed 17? Kara Jernigan. Kara, saw you last night. Getting strong, sister. Junie Cannell, Austin Ward. Haven't seen you at Circuit for a while. And Gina and Nemo. I haven't seen you in a while, Gina, but I found an old picture of us that I'm going to bring up. Where's it at here? Look at that, Gina, when we ran into each other down at Bon Air. I have no idea how long ago that was. Anyway, thank you very much for listening. Thanks for growing with us, and slay on.